Muted, Minister.
Yeah, I didn't hear the answer.
Thank you. Thanks very much for the question. Listen, we continually streamline processes. As I mentioned, the support fund was designed with efficiency in mind to get money out of the door quickly, but nonetheless, still hearing that there are still barriers. So the Deputy Minister right now is looking at how we remove even more barriers in terms of accessing that emergency support really quickly. But I'll just point to the fact that over the past 2 weeks, we've been increasingly putting people into place in Bearskin as soon as the hand went up that there was help needed. So as I mentioned in my remarks, there were 6 health professionals from Indigenous Services Canada, 12 Bearskin Lake community members paid that came from Thunder Bay, 2 community disaster relief Ontario employees from the NGO Alliance, 3 Team Rubicon members, 2 public health nurses from Sioux Lookout First Nations Health Authority, a home care nurse from Wendigo First Nations Tribal Council, and 28 Wendigo Tribal Council members and 6 community members paid for by funding from Indigenous Services Canada. So why I reiterate that is because as the needs climbed, so did the support, and it will continue to be there for as long as the community needs that support. Now, when the military request comes in from the province, as I said, immediately upon getting that request from the province of Ontario, the military was assessing what additional supports the community needed and whether or not there were specific skill sets that were absent in the community. It's really important before, obviously, any deployment of professionals that we send the right ones. There's no point in sending professionals that don't have the skill sets or are unequipped to deal with the kinds of tasks that the community is looking for. That's the nature of the kinds of conversations that are happening, as I said, once or sometimes twice a day with Bearskin Lake. Patrick, maybe you could speak a little bit more about the kinds of work you've been doing over the last few weeks to make sure that the increasing level of care was the right suite of services for people.
Absolutely, Minister. And let me just start by saying, that we have been working very closely with Bearskin Lake First Nation leadership, with Wendigo First Nations Tribal Council, the Sioux Lookout First Nations Health Authority, the Province of Ontario, who has a huge role here as well, the local public health unit. Basically, what I'm trying to say is that a systems approach is needed in these situations, and everybody has a role to play. And we've been having those discussions and have been engaged since, early December on the rise of COVID cases within the community. And as the minister said, ensuring that as gaps were identified or needs were identified, that collectively as a system, we were filling those gaps. So daily calls among the partners will continue to take place in order to continuously reassess the situation on a daily basis, to identify any of those gaps that might exist as things evolve in the community, and to continue to ensure that the support to the community and its leadership in their response to the outbreak is there. The minister spoke a lot about some of the resources that have been put into the community from various partners, some from ISK, some from WAHA, some from the SLIFNA, some from the province. So this has really been an all hands on deck type situation. From a financial perspective, just to give you a bit of background, since the beginning of the pandemic, it roughly represents $5.8 million to Bearskin Lake since the beginning. And that's in terms of direct funding to Bearskin Lake and indirect funding for the community through Wendigo First Nations Council and the Sioux Lookout First Nations Health Authority. So this has really been all hands on deck with various players coming to the table and providing support, whether financial or whether through resources, to make sure that the needs of the communities are being met. And that's only going to continue to work through continuous engagement and solid partnerships with the community, with the leadership in the community, and with the various partners that have a role to play.
Thanks.
Thank you. Next question is from Leonard Monkman from CBC Indigenous. Please go ahead. Your line is open.
Hi, Minister Hadju.
In places like Manitoba, the number of cases are being severely underreported because of testing changes in the province recently. Are the number of cases being underreported in First Nations? And if so, are there any estimates on how many cases might be underreported since Omicron has been first detected?
Thank you for that question. I think I'll turn to Dr. Wong first to speak a bit about his understanding of the accuracy of the rate of cases in Manitoba First Nations.
Thank you very much for the question. As with both Indigenous and non-Indigenous communities, because of the overwhelming number of cases across Canada, the testing ability of each jurisdiction, is in a very challenging situation. Therefore, both in Indigenous communities and in non-Indigenous communities, including First Nations communities in Manitoba, the number of diagnosed cases, actually an underestimation of the number of actual cases, including more and more people are using self-test, home test, to actually make the diagnosis. And some people may not even want to actually get tested because, of a variety of reasons. In order to, address, this, I think that the important thing with Omicron is less so on the number of cases, in Canada or in a province or in a First Nations communities, but rather, is to actually look at, is it impacting on the number and the rate of hospitalization in Canada and, for First Nations communities. At this point, thus far, we are not seeing signals, of increasing hospitalization rate based on per case. So out of every 100 cases, again, we are actually seeing less than other variants, on, the risk of hospitalization. And that, goes for not just, in First Nations communities, but also, in the general Canadian population as well. But going back to my earlier comment, it is so important, to redouble the efforts to protect the most vulnerable within Indigenous communities. So with that, over to the Minister.
I think that's pretty comprehensive. Thanks, Dr. Wong.
I guess my follow-up question would be, which First Nations are reaching out and what are they currently asking for, and how has that changed since the Omicron wave has been detected in First Nations communities?
Well, we're working, thanks for the question. We're working with a number of First Nations in a variety of different provinces with a variety of different kinds of requests. And so I don't think we can comprehensively give you a full list over in this news conference, but and certainly, happy to provide some details to you in terms of the kinds of requests and the numbers of requests. But I'll just say this, it's clearly a time of, illness in the country. And as cases go up in general population, urban settings, of course, it creates additional risk for Indigenous communities that are often even more isolated and have specific needs and some fragilities, as I mentioned in my opening remarks, in terms of capacity, in terms of housing, in terms of all kinds of other support. So we're watching very closely and working very closely with First Nations communities across the country to make sure that we can support communities as they see case numbers go up, and hopefully keep case numbers down as low as possible by supporting communities to take appropriate action when they start to see infection enter into their own communities.
Thank you. Merci. The next question is from Stephanie Taylor from the Canadian Press. Please go ahead. Your line is open.
Hi, thanks, Minister. A few answers back in talking about Bearskin Lake and the situation there, you said that you also felt frustrated. I'd like to know why you're feeling frustrated. What specifically are you frustrated with?
Oh, well, thanks for the question. I mean, for me, the goal is to make sure that communities feel that they've been well supported. And so, when I hear that communities are still struggling with that sense of being supported, that obviously makes me want to understand how we can better meet their needs and how we can better open up lines of communication. Obviously, I'm not only in communication with Bearskin. I regularly reach out to local chiefs and to regional chiefs, and of course, speak on a regular basis with the national chief. But it is important for me as a minister to feel that we've done absolutely everything we can to support communities. And so that's, the nature of my conversation today with Chief Kaminawataman was about making sure that I understood where gaps still existed. As I mentioned today, he talked about the need for additional vehicles. I've already passed that on to the deputy. I really want to make sure that we have the right blend of supports in place for Bearskin. It's great news that they're getting better and that people are increasingly coming out of isolation, but it's very important to me that that we're there as vigorously as possible and that we're understanding the needs on the ground.
Thanks for that. I'm still trying to understand, why it is that there's some 300 military members in Quebec right now giving vaccinations while Bearskin Lake, a remote northern First Nation, says they need more federal help, including from the military. So the assessment process you're talking about, do you think that needs to be reviewed in light of what some could perceive to be a discrepancy?
I think those questions around the military assessment, are best appropriately posed to Minister Anand. But I will say this, the Canadian Armed Forces has immediately upon getting that request from the province of Ontario, sent in a team to assess what those specific needs are, what the skill sets would be, what the Rangers would be doing, and how they could best support the community efforts and the current resources on the ground. Not every need is best met by the military. Some are not. I can't speak to the decision around, the need in Quebec, but I can tell you that, as I reiterated to Chief Kaminawataman today, we'll be there for the community to help the community get through this. Patrick, you've been working really closely with the Government Operations Center and with this particular request. Maybe you can speak a little bit more about the kinds of considerations that go into these assessments.
Absolutely, Minister. And as I outlined earlier, through the RFA process, this is when, again, the province feels that they don't have the ability to support communities across their jurisdiction in responding to the crisis. But just to give you a sense of what the Canadian forces on the ground have been authorized to support with, they've been authorized to support. They will be integrating into the local emergency operations center command post in the community to coordinate activities with the chief and his council and other partners. As I said earlier, there's a lot of partners here at the table, assuming different roles. They'll be providing limited logistical and general support to include, but not limited to, transportation assistance, resupply, and humanitarian assistance. They'll be supporting the community in the distribution of real-life support requirements, such as food, water, firewood, and care packages. And they're going to assist with the distribution of very important information from community, provincial, and federal entities related to personal protective health measures and layered risk mitigation strategies. And where necessary, they'll be conducting community wellness checks. So this is what they've been authorized to perform within the community. And of course, it's the community in the driver's seat. They are there to fill those gaps within that framework that I've just articulated.
Thank you. Merci. The next question is from Eric Stolber from Global News. Please go ahead. Your line is open.
Hi, can you hear me?
Yes, go ahead.
Okay, thank you. Thank you for taking my question. I wanted to ask about the streamlining of the process. I covered this when the military first arrived in the community, and I believe it was 2 or 3 members that went there, and I think it was 1 or 2 weeks that they were there to assess the situation. So in a situation like this that's very fast moving, is that really a streamlined process of 2 or 3 weeks of only 2 members in the community to figure out what's going on? Is there a way to provide support faster?
Thanks, Eric. I assume you're talking about Bearskin. Are you talking about Bearskin?
Yes.
Okay. I won't read through the list of the supports that were already in place through a variety of partners, including Indigenous Services, including regional health authorities, including Wendigo Tribal Council, because of course you've heard that, and I think it's on record. And I say that again to say that there was no delay in responding to the community's increasing requests for support, whether it was health supports or personnel supports or financial supports or charter supports or transportation supports. We've increasingly stepped up with the province and other regional partners to make sure that the community had what it needs to stay well, to bring down the number of people getting sick, and to recover from such a high rate of people having to isolate as a result of either being positive or being a close contact. When we received the military request from the province of Ontario, we immediately, the Canadian Armed Forces immediately sent out people to assess the situation, as I said, to understand where those gaps continued to be. Because, again, the right people for the right purpose at the right time is really a critical kind of consideration as we're responding to these crises. We want to make sure that we're sending in the right set of skills, the right kinds of individuals to deal with the right kinds of problems. And so maybe I can turn again to Patrick. I know you've covered this already, but to talk about that growing support from the beginning days and how, adding those layers of support helped contribute to the functioning of the community in a tight time.
Sure. So as I mentioned earlier, there's the financial aspects of things, but again, just to reiterate, in early December, these daily conversations began with the community, with system partners, to make sure everything was being addressed. So just for example, from an HHR perspective, a health human resource perspective, registered nurses and advanced care paramedics from Indigenous Services Canada were deployed to the community. Public health nurses from the Siouxsie Lookout First Nations Health Authority were deployed to the community. Home care nurses from Wendigo First Nations Tribal Council were deployed to the community. And Mattawa Tribal Council nurses in Thunder Bay were coordinating and conducting COVID-19 tests for all passengers before boarding flights to enter the community. In terms of other types of support, Bearskin First Nations band members from Thunder Bay and Community Disaster Relief Ontario employees also were contributing. Team Rubicon members assisted with cutting wood for fuel and providing fire safety monitoring. Community members paid by ISK are now receiving and delivering food and essential supplies to affected households. And this didn't all start last week or within the last few days. This has been, as the minister said, a growing effort to support the communities as gaps were being identified, as needs were being communicated to the system partners.
Thank you.
Do I get a follow-up? Hello.
Go ahead.
Mr. Stober, do you have a follow-up?
Yes. Thank you for those answers. Another question is, the communities are in charge, in the driver's seat, as you said, for their own measures. So can you go over in the communities, specifically as Bearskin Lake, what measures they're putting in to avoid these terrible outbreaks?
Well, maybe I can start and then turn it over to Patrick and Dr. Wong. I mean, I think one of the things that the community, I have to applaud the community for doing earlier on and being prepared is the high rate of vaccination. I think that is the success story, if you will, in this terrible time, because in fact, it protected so many members of the community that did contract COVID-19, but it protected them from hospitalization and severe illness. And so that's preparation. That's the community working in advance with partners like the province of Ontario and the health authorities to vaccinate people quickly and get people boosted so that we could so that they could collectively protect each other. I know, the community has obviously had a number of other practices in place over the past while, but nonetheless, when people get sick, as Dr. Wong pointed out, this is a rapidly moving virus and it spreads really, really quickly. So it doesn't take a number of that many people with Omicron to really infect a small community to the degree that we saw with bearskin. But the protective factor of vaccination truly is the success story, to have so many people infected and yet not one hospitalization to date is really a testament to the commitment of the community to vaccinate and to protect each other.
Thank you. Merci. The next question is from Christian Ajkute from CTV News. Please go ahead. Your line is open.
Hey everyone, thank you for taking our questions. My question is for Minister Hadju again. I know you've been pressed on this since we started this conference and the media questions, but the chief asked for 40 military representatives and instead got 3 or 4 rangers. From my understanding, was the chief's assessment wrong on this? Was he wrong in terms of the community's needs? Like, how did we get from 40 to 3 or 4 rangers?
Well, thank you for the question. And again, this is not something that's solely decided by one person. This is an assessment and a collaboration. I think Patrick Boucher has spoken about the collaboration amongst multiple organizations and the province of Ontario. When the province of Ontario determined that bearskin needed additional supports on top of the supports that were already in place, the assessment went forward with the Canadian Armed Forces once that formal request was in. And Patrick, maybe you can speak to the ongoing assessment with the community and with the various emergency managers that you've worked with on this response.
Yeah, absolutely, Minister. And just to reiterate again, there has been several resources deployed to this community to support the community and to support the situation that they were dealing with, the very difficult situation that they were dealing with. And the minister, listed some of them earlier with the 3 primary care nurses, the advanced care paramedics, the rapid response environmental health officers, Bearskin Lake community members from Thunder Bay, 12 of them, the Community Disaster Relief Ontario, and the list goes on and on and on. But to answer your question, this is a daily assessment. These are calls that are being conducted on a daily basis and several times twice a day to ensure that there is a rapid response and a measured response to the need. This pandemic is difficult, and Dr. Wong could speak to the evolution of the virus. I think we're all well aware of that. So that continuous contact with the community and partners is the only way that this is going to work. And leveraging emergency operation centers and the structure that exists with the province and system partners is the only way to address these needs in a very effective and in a very decisive way. And I think we've seen that throughout the last couple months with Bearskin Lake First Nation. Dr. Wong, did you want to add anything in terms of the?
Yeah, maybe just one point to make about this virus. The testament to the tremendous work of the community, the decisive actions, supported by many different partners, just like what ADM Boucher had just said. Whether it's the province, whether it's neighboring First Nations, Indigenous Services Canada, and the military, it takes a collective effort in order to try to support the communities. And the end result we are seeing, not only are we seeing the drastic reduction in the number of active cases in the community, but also not one single hospitalization nor fatality out of that. That's a testament of the tremendous effort of the community supported by others. Thanks.
And my follow-up question is, last week, the leadership requested, I think it was 3 or 4 dome isolation units. Was that request answered, and does the community have those isolation units? Because they were talking about, they didn't have anywhere to put the infected to isolate them safely from the rest of the community.
Yeah, well, we'll have to get back to you on that one. I know that there was talk about the need for alternate isolation sites, and there are some domes that were offered to the community earlier on when this issue started to evolve, and that offer has remained on the table for some time now. In terms of the status of whether the community still requires that or would or believes that or would like to have those isolation units, as I said, the offer's been made, but we could follow up on that one as to the status.
Thank you. Merci. Once again, please press *1 on the device's keypad if you have a question. N'hésitez pas à faire étoile 1 pour toute question. The next question is from Rick Garrick from Walate News. Please go ahead. Your line is open.
Hello, I'm calling about a question about the water situation in Bearskin Lake. I understand everybody in the community has to go to a central location, I believe it's the store, to get their drinking water. Now, when there's a crisis like this going on and people are having to isolate and you don't want to go around other people, this shows a problem with leaving all these communities without proper drinking water. I wonder if Minister Hadju wants to speak on this.
Well, first of all, I will speak on this, and then I'll let Patrick to talk about the delivery of water to houses, which I know was an aspect of trying to reduce people's mobility while they were isolating. But I will say, Rick, and it's nice to hear your voice, I will say that you're absolutely right. And I said that in my remarks. We need faster action together on things like clean drinking water, on things like suitable and decent housing, on making sure that communities have infrastructure in place that supports their, in some cases, growing population. And that's why I included those comments in my remarks, because as a Minister of Indigenous Services, it's my job to go out there and to fight for the resources and the partnerships to make those things happen. And it's a powerful reminder, and I know Dr. Wong, I'm sure, has thought about this a lot, about the importance of something that for a long time public health has called for, which is an investment in things called the social determinants of health, or those basic needs that everybody needs to stay healthy. Those are things like housing and access to water and access to healthy, nutritious food. And we've got to do a better job collectively in making sure that every person in this country has access to those basic fundamentals of health, because of course we can see just how hard it is when people don't have those very basics. And so, Patrick, maybe you can speak a little bit specifically about the work done to distribute water during this crisis.
Yeah, some of the resources, to get right to the point, some of these resources that have been provided to the community are to support exactly that, to ensure that the real life support requirements, such as food, water, firewood, and care packages, is being addressed. So our updates, indicate that those needs are being addressed. And there's bottled water that's being delivered to isolating homes across the community.
My concern was, in a situation with this pandemic going on, everybody having to go to the same place to get a certain item, and that's what's happened in Bearskin. I think it probably in other communities, they all have to go to the same one place to get the water. Every single person, every household in that community is going to get water from there. That could be like a vector for any kind of virus that's going around. And we're all being told to try to avoid gathering. And this is one thing that drinking water is a need. So I wanted to bring that up again.
And maybe I can respond that is some of the work that was being paid for through a variety of partners, including Indigenous Services Canada, to pay people to be able to deliver food, to be able to deliver drinking water, to be able to deliver those essential ingredients to families and homes so that people didn't have to gather or come out of their home when they're isolating. The whole point of isolation, obviously, is that you don't gather and you don't connect with other neighbors or other community members. And so that response did include paid supports to deliver those essentials from door to door to families who were isolating.
But what I mean is, before it hit, people were going all to the same spot. That's the problem with everybody having to get water from a central location. Everybody has to get it, and it could be a possible vector for disease, like what's happened there, and it could happen anywhere. Could you imagine if every single person in Thunder Bay had to go to the same place and get their drinking water?
I think we're not arguing at all, Rick. I think we're agreeing that running water and that those basic needs have to be in place for optimal community wellness, and that's why we've been so strong on committing to ending boil water advisories. There are about 37 left in the country, and my focus is on making sure that we have everything in place to be able to lift those boil water advisories. And so in terms of this particular outbreak, you're absolutely right. Those essential ingredients to day-to-day functioning need to be there and need to be in place. That's why I mentioned them in my remarks at the very beginning, because I personally recognize just how deeply communities are impacted if they don't have access to running water, safe and affordable housing, and many other essential ingredients to public health and in communities.
Okay, thanks for your help.
Thank you.
Opérateur, on va prendre une dernière question si...
Oui, absolument.
Operator, we'll take the last question. Well, there's only one left.
And it is from Willow Fiddler from the Globe and Mail. Please go ahead. Your line is open.
Hi, thanks. Just another question from me, only because it continues to be repeated and brought up in terms of the support and resources that your department has provided for Bearskin Lake to date to address their COVID outbreak. But the reality is, I guess I'll put this on the record for a response, is that one of the people I've talked to who have been working, behind the scenes and involved in the day-to-day calls, there's no doubt that the work that has been done and the efforts made by the groups that you mentioned, including Silicote First Nations Health Authority, Matawa, Wendigo Tribal Councils, and the funding commitments made to them. But the reality is that those efforts and resources have already been there and were, coordinated immediately by them. I'm trying not to get too confusing here, but someone had said, that you guys are taking credit for work that is being done by other people on the ground, and it is the actual on-the-ground presence that had been requested by Bearskin Lake in the form of military support, in the form of military personnel, not from the community, not a local Canadian Ranger that is in isolation, because all households were in isolation, or most. But can you respond to that? Because I don't think anyone is doubting the commitments that you have expressed that you guys have provided and listed. The other thing is that, those funding dollars, I'm hearing that those funding dollars, haven't yet made its way to those organizations. So they're really, mobilizing themselves in the absence of the government support that had been requested.
Well, maybe I can take a stab at it, and I will turn to Patrick. But listen, this is a shared response that Indigenous Services Canada is fully engaged in. In terms of whether or not money has reached its intended source, we'll take that back, because my understanding is money has been released. But if it's not reaching the organizations and or the community itself, that's deeply concerning to me, because I've heard otherwise. So we'll find out the nature of that and make sure those payments are out the door. They're usually turned around very quickly, but we'll double check on that. In terms of taking credit, absolutely not. I think, when I listed the resources in place, I was very clear to be very specific about who has provided what resources. This is a shared response. This is obviously something we're working on with the province, with the regional health authorities, obviously Indigenous Services Canada, and now most recently the military. And so, I really want people to understand that we're there in partnership, in strong partnership with strong assets in play, but definitely in partnership with the province and with regional health authorities and with tribal councils. Patrick, maybe you can speak a little bit about the collaboration on the ground. I will say that it's been heartening to see so many people come together so quickly to really support this particular community. But Patrick, maybe you've been involved in those conversations. Maybe you can talk about that collaboration.
Yeah, the collaboration has been tremendous, and we've mentioned the partners several times now on this call, and that is truly the only way, and I'll reiterate that, the only way that collectively we could be organized as much as possible during difficult times to be able to respond. And I also want to reiterate a point that the minister made earlier around the tremendous leadership and credit that needs to go to community leadership and the communities themselves for all of the work that they've done throughout, this almost 2-year pandemic now. The legwork and the effort and the sweat and the blood and tears that went into ensuring that they had high vaccination rates have tremendously paid dividends, and Dr. Wong spoke about that as well. And those efforts as well were undertaken through a coordinated partnership approach, where the various partners, came to the table and rolled up their sleeves and contributed to the challenge to ensure that the community had what it's needed, that it had what it needed, that the leadership within the community was supported and complemented. So again, we can't emphasize enough the importance, and this doesn't just apply to Bearskin Lake First Nation in Northern Ontario. We're seeing this across the country, and there's been some tremendous stories and successes across the country. And I would say that much of that is due to the partnership approach that has been taken across the country and across the communities, and to the specific leadership and decisions that communities made themselves to protect their members and to protect their elders and their most vulnerable. Thanks.
No follow-up?
No, that's good. Thanks.
Alors, c'est ce qui met fin à la conférence de presse. Thanks for everyone for being with us today. Thanks for your time.
Thank you.
Thank you.